Paul Watson, Jr. I am the president and CEO of the Global Action Research Center here in San Diego. That organization is a social change organization. It has been collaborating with UC San Diego for about 10 years. We've been working mainly with the Center for Sustainability, Science, Planning, and Design within the Urban Studies and Planning Department. When COVID hit, it created an opportunity for us to work with different departments, the School of Public Health and also the School of Medicine at UCSD. And so the schools put together a grant with the National Institutes for Health to work on engaging the community to try to find out why people were hesitant towards taking both the test for COVID as well as the vaccine.
My name is Bill Oswald. I'm the Associate Executive Director for the Global Arc. Global Arc is kind of a unique organization. It's a social change organization, and our focus is really on helping communities that have been excluded from the public dialogue to be able to bring what we call authentic demands onto the system. UCSD is one of the top universities in the world and has an enormous amount of knowledge. And so being able to tap into that knowledge and bring it to the community in a way that's useful to them has really been important for us and for the community. Universities pretty much are closed systems. And again, it's a public university, so how can it serve the community? And so our role was to then bring the community and the university together.
My name is Borsika Rabin. I'm a public health researcher, implementation scientist, and faculty at the Herbert Wertheim School of Public Health and Human Longevity Sciences, and I am the co-director of the UC San Diego Dissemination and Implementation Science Center. My research focuses on creating and co-creating solutions with partners for public health priorities. I like to use the tools of implementation science to create these solutions, and my partners include community members, clinicians, operational leaders, and other researchers.
My name is Nicole Stadnick. I'm a clinical psychologist, implementation scientist, and associate professor in the Department of Psychiatry at the University of California in San Diego. My program of community-engaged research focuses on identifying and implementing and co-designing health interventions that are evidence-based and community-vetted.
My name is Nao Kabashima. I am Executive Director of the Karen Organization of San Diego.
My name is Hamadi Jumale. I'm working with the Somali Bantu Community of San Diego as Executive Director.
Pues mi nombre es Mónica Rocha. Soy directora de Latinos y Latinas en Acción por 15 años directora, vamos a cumplir 20 años Latinos y Latinas en Acción. Soy de la comunidad de City Heights, 30 años de mi vida la he vivido en City Heights.
Soy Delfina Álvarez, trabajo como voluntaria comunitaria en el área de City Heights. Pertenezco a un grupo comunitario llamado Comité Organizador Latino de City Heights. Llevo trabajando 5 años ahí, haciendo abogacía por mi comunidad que tanto necesita ser escuchada.
Within the Global Arc, we have an analogy that we look at community as using a kind of geological kind of perspective. And so if you think about it that way, when you start digging into the ground, you're hitting topsoil, which is kind of easy, but eventually you're going to get down to a hard surface. It's kind of like hard clay. And most research work stops there because it's too hard to get beyond that, right? And so we were able to open that up. And when I talk about the clay line, for us, that means refugees, immigrants, communities of color, and also youth. Because if you're not old enough to vote, no one really listens to you anyhow. So what we were able to do is help those researchers get into areas that they never usually get to and have those voices elevated so that they could be a part of the dialogue and help us to really begin to change the way that things were going to happen and unfold within their communities.
We started to work with the Global Action Research Center in mid-2020. This was a time when we were writing a proposal for the National Institutes for Health to implement a program for equitable COVID-19 testing.
We were thrown together in a very quick way to develop a grant proposal that would address disparities in accessing testing and care resources for underserved communities in San Diego. And so it was a natural just connection between the research, the public health research side, and the Global Action Research Center.
Well, so excited to have all of us back together again. It's been a little while since we last did the training. Just to give us a little bit of, again, remember what we're doing and some context to this, is that one of the things that came out of the research work that we did with UC San Diego, and all of you are a part of, was really about COVID. And if you remember, really, when COVID first hit, there was a lot of confusion in the community about not only about getting tested for it, but then also for the vaccines. And so what we did in terms of this research project was to really get into the community to try to find out like why people were hesitant about that, what were some of the issues, right? And then what could be done to change that so that people could be comfortable, they had enough information, and that basically we could protect our communities from this horrible pandemic.
Hello, everyone. My name is Angel. If you haven't heard of me, I'm a student at UCSD, and I'm interning also on the UCSD side. So basically what this training, what these slides are about is all of the surveys that you all completed during the trainings. If you recall, there were 5 trainings. First one was kind of a little overview of the project. The second one was identifying and building power. 3 is assessing power. 4 was creating a vision and cutting an issue. And lastly, our last session was building your base.
In the Co-Create project that we did, we were able to get thousands of more people in the community vaccinated or tested because the university and the healthcare system listened to what the community leaders told them.
Hay que recordar que
We
en
have to
ese
remember.
salón habíamos líderes de
At that room, in that
diferentes
room,
tiempos
there were
en la
leaders
comunidad.
in different areas of the
Y los
community.
resultados para mí
And the
son
results
buenos,
are good,
buenísimos,
very
porque
good.
estábamos en diferentes niveles.
Because we're at different
Entonces
levels.
quiere decir que sí logramos conectar
We were able
y
to
entender lo que se
actually
nos estaba
connect.
proporcionando en los diferentes niveles que estábamos.
The different levels were coming
Muy
together.
bueno, yo estoy
This is
muy
extraordinary.
sorprendida con el resultado.
I'm very surprised actually with the results.
One thing that we know, and it really an important principle for the Global Arc, is if you want to fix a problem, start by talking with the people who are living with it.
I said my name is Ramazan Madende.
Siza hano ndani mwa United States 2004.
I came here in 2004.
Marka kuna mburi nyingi sazipatire male sizipata kwa ngano nyingi ya
So that there's a lot of misunderstanding and knowledge that I was missing. But since I started working with the Global Org and the researchers, I'm learning something. It's just opening my eyes about because there was no resources that can make me understand what is going on.
Sifurahika sana kabisa
kwa I'm very happy.
Kwa kuingira wantu mbuli sazimanyize ndekudafa community yangu.
And the training make me feel like a little knowledge, but I feel like give me a little knowledge to learn that there was something that I was missing in life that I was not getting because nobody was inviting me.
I was working on a project with some compañeras, some colleagues. And we were using some of these steps. And I want to find out and learn those tricks. How much more pressure do we got to put? So we ain't gonna get stuck in the middle. So these workshops, these trainings, I want more because it's very useful. And a campaign. How we can do an alliance, a campaign, a specific campaign, us together.
Our main goal is to figure out why solutions that work are not implemented in communities, in clinical settings.
The issue that the Latinos have, the same other refugees have. And mostly when I feel like some of us, we're coming here, with the language barriers, and we feel like the same thing with the Latinos. So they have the language barriers. Maybe they may not have they may not have access to the healthcare because of the language or because of knowledge. So the same thing with the other refugees people. So if we stand together as a unit, as a refugee, and we make the power, we can have a voice. Thank you.
And I think it's important that he said that. Being together as a community, working together, is very powerful. And I noticed through the years that it's because we are so divided for any reason, that is because that's why we don't have the power that we deserve. We're here because we want better life, and we're trying to get better life through our hard work. So that's good. I support what he has said. Thank you, compañero.
As you know, the Global Arc, we're all about social change. And so we spent a lot of years studying it and understanding what needs to happen. However, in San Diego, it's a very difficult place to build the kind of power for change that we want. And one of the reasons is because it's so diverse. So we have so many different cultures that are here, and with language barriers, with customs, with religion, all of those things create these little barriers that we don't really understand one another that well, and we kind of stay in our community because we're comfortable in our community. But in order to bring about the change, one of the things that I was so excited about with this training is at the end of the training, without Bill and I saying anything, you all came together and said, we've got to work together.
The work with the Global Arc had significant impact on my professional and personal life. It had a very substantial impact on how I do research, how I teach, how I interact in the public health space, and I think I became a better private citizen as well. If I have to pick one specific area that really impacted me, it is the way that Paul and Bill define community.
It's really important for me that our community members from Burma have opportunity to share their stories and their voices, because they are from the country where they've been persecuted just because who they are, because of their ethnicity, their religions, and they never, in their own country, their voice never mattered. And so I think being part of this type of work with UCSD and Global Arc, I feel we have more opportunity to be in that kind of space and then to share more stories.
Ha sido buena porque todos tenemos que aprender algo siempre, cada día aprendemos algo nuevo. Si te digo que ya tengo 15 años en la comunidad, pues he visto mucho. Y me gusta cuando están haciendo investigaciones así y nos incluyen.
Transformative. It has been. I'm a clinical psychologist. I'm in the practice of working with individuals on really sensitive and hard topics, mental health needs, and translating that and the ideas of true, authentic community engagement into practice to impact communities, again, that have been historically not engaged in research, has just transformed my way of thinking and really what I'm excited about. And so the idea of being able to co-create and co-design health solutions with organizations and with community members just really lights me up. So I've been just very, very impacted in a positive way through the collaborations with the Global Action Research Center.
The Global Arc and UCSD help us because of the researches that they did, because our community doesn't know, they have no knowledge to understand about health issues and doesn't have access to any information. But once if I get the information from the Global Arc, from the resources, so I bring back to my community. We do have a board members, so we do have a staff, so I can share with them the information and they deliver to the community. They are coming for resources, so those communities get the resources through our organization too.
Creo que nos ha empoderado nos ha dado mucho valor a la comunidad, nos ha enseñado, nos ha entrenado. Aunque nosotros tenemos el amor a la comunidad y querer mejorar, pero trabajar con las comunidades a veces se torna difícil. Entonces nos ha dado esos entrenamientos de cómo llegar directamente a la raíz del problema, cómo solucionarlo, cómo guiar a nuestra comunidad, alzar la voz para beneficio de todos nosotros.
Some of my takeaways from this is that it is possible for the university to learn how to work with the community, and it is possible to build trust in the community. In the Co-Create project that we did, the university and the healthcare system listened to what the community leaders told them, and once they implemented what they were told, they saw their numbers rise in both vaccinations and testing. And so it's really about it's hopeful that universities, particularly one like UCSD, which is such a research university, that it can stretch and make their desire to be a rooted university authentic by taking the time to bring the community into the dialogue.